On the superficial side, we've got all these newer minimally invasive technologies, but they're not perfect. So there's still room for more innovation in some of those technologies. So for example, we have these thermal technologies, which we put a catheter on the inside of the vein and then we burn the vein, but that requires us to surround the vein with tumescent anesthesia so that the patients don't feel it. So that 3 to 5 minutes of instilling that tumescent anesthesia is kind of the uncomfortable part of the procedure. I think many companies are working on technologies now where we can eliminate that part where we have to give multiple lidocaine injections, where we can do it through the catheter that's already there. So if that happens, then this procedure is going to be completely painless. And I think that's going to be one of the next big innovations that's coming down the line. Now, again, one of the CVR differences is that we use every technology that's currently available on the market and we individualize that to their care. But the difference with CVR is we go back and we analyze our data. How did that technology do? Did it work well? Did it not work well? What group of patients would benefit? What group of patients would not benefit? I guarantee you that the majority of the vein centers across the country do not do that level of analysis like we do. And that's an area of great pride for us. The other thing that we see a lot is, particularly in women, is that if they have a pelvic venous disorder, it's 99% of the time either missed or misdiagnosed. So with CVR, what happens is we're going to evaluate all of you. So you're going to get your ultrasound, you're going to get a consult, we're going to tell you what the relationship is between your varicose veins and whether or not there may be a pelvic component, because most women don't realize that their pelvic symptoms may be related to their veins, and to them it's this great mystery. I cannot tell you how many women I've seen in my office who've been looking for an answer, who've been told their entire lives that they're crazy, and when they find out that they actually have a disorder that can be fixed, the relief that they feel and the validation that they feel is overwhelming. So that's another great thing that we see at CVR is our physicians evaluate all of the patient. We're not just leg doctors. We do a comprehensive review of the patient. And if we feel that there are other issues that may have been missed, we call our referring physicians and we share that information with them and we work collaboratively with them. We take a holistic approach to the patient.